So I've been really happy to see in the last 15 years since the publication of the first edition of my first book, Lean Hospitals, that not only has my book been translated into, I think, 8 different languages in different parts of the world, but that the lean methodology has been applied in a wide range of health systems, not just in North America, not just in Japan, but in countries all around the world. And I know there are people in Malaysia working on this in their hospitals. In fact, some of them have been part of study trips with me to Japan to go visit Japanese hospitals and to go visit companies like Toyota. Not because we are trying to turn the hospital into a factory. We just want to learn lessons from other organizations, other industries that we can apply to improve the way we do our work in healthcare. And these are kind of long-standing problems. I'd like to share an example from the United States, from Detroit, Michigan. Henry Ford, you probably know as the founder of Ford Motor Company. He, in 1922, owned a hospital, and this is now part of what's still called Henry Ford Health System. As he saw from his observation and study of the hospitals, as he described in one of his books, in what he called an ordinary hospital, the nurses must make useless steps. More of their time is spent in walking than in caring for the patient. And I've seen studies in recent years that nurses in different countries around the world generally only get about 30% of their time at the bedside with the patient. And this is not anything we would blame the nurses for. We would ask, why are they having to be away from the direct patient care activities? So we can look at the structure of support systems. Why do they not have the supplies, the equipment, the medications that they need readily available? Why are nurses spending time searching for what they need to provide the right care in the right place at the right time? In the lean mindset, we're not focused on telling nurses to try harder, to work harder. It's about making work easier for them. When we look at inefficiencies or quality problems, the lean methodology really emphasizes that the cause of these problems is not the so-called bad apples. Dr. Don Berwick, the founder of the Institute for Healthcare Improvement in the United States, an organization that's had global impact, he's been teaching this for decades, as have other leaders in the healthcare quality and patient safety movements. Instead of blaming and punishing or trying to remove quote-unquote bad apples, we need to improve processes. We need to improve communication. We need to break down silos across departments. We need to better support the people doing the work. And along those lines, I'd like to quote and cite another friend of mine, a former Toyota leader from the United States, Darril Wilburn, who says quite clearly, and I think this is something worth emulating in other settings, including healthcare. As Darril says, it's the responsibility of leaders to provide a system in which people can be successful. It's the responsibility of leaders. And I think that's a really important point. That doesn't mean leaders have all the answers. It doesn't mean leaders fix everything. But it means that leaders engage and support everybody in the organization in the important work of safety, quality, delivery, cost, and morale. Change cannot be forced on people in a top-down way if we want it to be accepted and sustained. Leaders have to lead, but they engage people at different levels of the organization in problem solving, kind of engaging or trying to find solutions at the right point and the right place. And generally about 80% of these improvements will come from frontline staff and their immediate managers when they're in a supportive environment, when they're in what we might call a lean culture.